Okay, so this is going to be our coverage of the heart. The heart is essentially a box of 4 chambers. On the top, we can see the right atria and the left atria, the 2 upper chambers. And on the bottom, we see the right ventricle and the left ventricle, making the 4 main chambers of our hearts. If we look at the atrias, we see there's a small outpouching that serves to increase their volume, and these are called the auricles, the pouches coming off of the atria. We look inside and we can see how the atria and the ventricles are connected to one another. Separating the 2 are valves. We can simply call them the right atrioventricular valve and the left atrioventricular valve. However, these are also known by the name tricuspid valve on the right and bicuspid valve on the left. When we look at the valves, we see a number of little white strings coming off of the valves, and these are the chordae tendineae. The chordae tendineae end these red papillary muscles, small projection of muscles that cling to the chordae tendineae to prevent the valves from inverting during a powerful contraction. Now all of these various chambers are connected by tubes, and we're going to chart the path of blood through the heart to see the tubes that are involved. We first of all have the superior vena cava and the inferior vena cava. These are bringing deoxygenated blood from the top half of the body and the bottom half of the body. They enter into the right atria. From the right atria, that deoxygenated blood will flow through the tricuspid valve into the right ventricle. The right ventricle then pumps the blood through the pulmonary semilunar valve, the small white bum here, into the pulmonary trunk, and ultimately it branches into the left and right pulmonary arteries. These arteries take the deoxygenated blood to the lungs, where they can pick up oxygen. The oxygenated blood then returns via the pulmonary veins that we can see here on the left or right side of the heart, and here on the left side of the heart. All 4 pulmonary veins dump into the left atria. The blood then flows from the left atria through the bicuspid valve into the left ventricle. The left ventricle then pumps the blood through that aortic semilunar valve, which we can see high up in the top of the aorta, into the aorta itself. From the aorta, the blood falls through the ascending aorta, the aortic arch, and the descending aorta. Now there are 3 spigots coming off of the aortic arch. We have the brachiocephalic artery, which is feeding the right side of the head and arm. We have the left common carotid feeding the left side of the head, and the left subclavian, which makes its way towards the left arm. There are also a few additional features that we did not discuss that don't really pertain directly to blood flow. One is if we look in the right atria, the white circle with the number 55 is the fossa ovalis. Secondly, at the bottom of the right atria, we see a small red dot with a number 58, and that's the opening of the coronary sinus. And finally, connecting the pulmonary trunk to the aortic arch, we have the ligamentum arteriosum. Now that follows us through most of the features of the heart, though I realized I forgot the septum, so to toss it in, we have the interatrial septum, or atrial septum, the wall between the atria, and we have the interventricular septum, which is the wall between the 2 ventricles. Now we can get on to coronary circulation. We first of all have the right coronary artery, number 31, coming off of the ascending aorta, and the left coronary artery, number 29, which we see poking out from under the pulmonary trunk. If we follow the left aortic artery, it branches into the anterior interventricular artery, number 50, running down the front wall here, and the circumflex artery, number 49, running beside the heart in the sulcus. If we go to the side of the heart, we can see the marginal artery, which is number 63, coming off of the right coronary artery. And on the back of the heart, we can see here the posterior interventricular artery, number 61, or tracing the posterior portion of the anterior interventricular septum. On the bottom of the heart, we can see this large blue swelling, number 27, which is the coronary sinus, and this is where deoxygenated blood from the heart enters into the right atria. If we follow off of here, we see 3 main tubes. Going to the left, sorry, to get myself in the viewer's perspective, going to the left, we can see the great cardiac vein, which traces around the heart and then down the front of the anterior interventricular septum. We can also see the middle cardiac vein, which traces down the posterior interventricular septum with the number 60, and we can see the small cardiac vein, which has this number 46 and traces towards the viewer's right. If we go to the front of the heart, coming down from the atria, we can see the small or anterior cardiac vein located on the front of the heart.